Cancer can kill you in a few ways. The most dangerous kind is metastatic cancer, where a single cell breaks off, travels, and starts new tumors. These tumors can fill up organs and stop them from working. If cancer takes over an organ that's essential, it can kill you. For example, if cancer grows in your digestive system, it can stop you from digesting food and absorbing nutrients. It can also block waste from leaving your body, which can cause a tear in your intestines that's deadly if not fixed with surgery. Another example is when cancer blocks the tubes in your pancreas. This makes your pancreas start to digest itself. Pancreatic cancer is one of the most painful and deadliest types. If cancer messes with your lungs, you might not have enough healthy lung tissue to get oxygen into your blood. In that case, people can die from suffocation. This is the main reason people with lung cancer die. The second most common cause of death in lung cancer is infection. Cancer weakens your immune system, and chemo makes it worse by hurting your bone marrow, which makes white blood cells. That's why infections are a big deal for cancer patients. Your bone marrow can get messed up not just by chemo, but also by cancer cells themselves. When cancer grows in your bone marrow, you eventually won't have enough healthy marrow to make blood cells. This causes a few problems. First, you'll get anemia, meaning you won't have enough oxygen going through your body. Second, your white blood cell count will drop, making it harder to fight off infections. Third, a drop in platelets means your body can't stop bleeding properly. Since your major organs are so important, it's tough to operate on them. Even if surgery goes well and they remove the tumor without permanent damage, the cancer can grow back. All it takes is a few remaining cells. That's why surgery plus chemo is important for these cancers. Besides organ failure, cancer patients can suffer from something called cachexia, which is severe wasting. This happens because cancer cells release toxins that cut your appetite and mess with food digestion, causing rapid weight and muscle loss. It's thought that about half of all cancer patients experience cachexia, and it directly causes up to 30% of cancer deaths, often from heart or breathing problems due to muscle loss. It even accounts for 50% of deaths in people with gut cancers, and up to 80% in those with advanced pancreatic cancer. Many treatments can keep cancer in check for a while, but if it keeps growing, it can become too much for the body, and eventually treatment can't hold it back anymore. At that point, the focus often shifts to comfort and quality of life. It's important to know that good pain control is available, and no one with cancer should have to die in pain. You might have heard that strong meds like morphine can make death happen faster, but experts say these pain medications are key for easing suffering and can even help patients live longer. I'll talk more about this in my next video if you're interested. Cancer is a complex and multifaceted disease that impacts the body in a number of ways, often leading to severe complications. As mentioned earlier, metastatic cancer is one of the most dangerous forms because it spreads to other parts of the body, forming secondary tumors. These tumors can invade critical organs such as the liver, lungs, and brain, affecting their ability to function properly. When cancer compromises essential organs, it can lead to life-threatening situations, including organ failure, severe infections, and complications that may require complex treatments or surgeries. In some cases, cancer can cause blood vessel damage within the affected organ. For instance, tumors can erode the blood vessels, causing internal bleeding. This bleeding may be slow and unnoticed initially, but it can become dangerous if it's not managed in time. The complications from internal bleeding can worsen organ function, which might necessitate urgent medical intervention. Another important aspect to consider is the effect of cancer on the body's metabolism. Cancer cells consume more energy than normal cells, and they release byproducts that can interfere with the normal function of healthy cells. This metabolic disturbance can result in unexplained weight loss, fatigue, and overall weakness. It's one of the reasons that cancer patients often feel exhausted and drained, even if they are eating regular meals. This disruption of metabolism can make it difficult for patients to recover fully from treatments and surgeries. Chemotherapy and radiation therapy are powerful tools in fighting cancer, but they also come with significant side effects. These treatments are designed to kill cancer cells, but they also damage healthy cells, which can lead to additional health problems. The immune system is particularly vulnerable, as chemotherapy can suppress bone marrow production, resulting in low white blood cell counts. This condition, called neutropenia, increases the risk of infections, which can become life-threatening if not properly managed. Cancer patients also often experience severe pain, which can be caused by the tumor itself pressing on nerves, bones, or organs. This pain can be constant and debilitating, requiring specialized pain management strategies. Fortunately, modern medicine has made great strides in pain relief, and there are various options available, including opioid medications like morphine, nerve blocks, and other pain management techniques that improve the patient's quality of life. Cachexia, or severe weight loss and muscle wasting, is another common issue faced by cancer patients. It's not just about losing weight, it's a complex syndrome that includes a combination of muscle breakdown and fat loss, which cannot easily be reversed through diet or exercise. Cachexia often leads to significant weakness, making it difficult for patients to move around, and it's a key factor in cancer-related deaths. Doctors and nutritionists try to help manage this condition, but it can be difficult to control without addressing the underlying cancer itself. As cancer progresses, patients may face issues related to fluid retention. Tumors can disrupt the balance of fluid in the body, leading to swelling, especially in the abdomen, legs, or arms. This swelling, called edema, can result in discomfort and can put additional strain on the heart and kidneys. In some cases, doctors might need to drain excess fluid to help relieve symptoms and improve the patient's quality of life. Brain cancer, or cancers that spread to the brain, can have particularly devastating effects. The brain controls nearly all of the body's functions, and tumors can lead to neurological symptoms such as headaches, vision changes, memory loss, and difficulty with coordination. If the cancer invades vital areas of the brain that control breathing or heart function, it can quickly become fatal. In some cases, cancer can affect the blood, leading to conditions such as leukemia or lymphoma. These types of cancers involve the uncontrolled growth of white blood cells, which can impair the immune system and make the body more susceptible to infections. Leukemia, for example, can cause fever, weakness, and bruising, and in severe cases, it can lead to life-threatening hemorrhages. The emotional and mental toll of cancer is often overlooked, but is just as important as the physical effects. Many patients experience feelings of anxiety, depression, and fear, especially when faced with a terminal diagnosis. The psychological burden of dealing with cancer can significantly affect a patient's overall well-being and can make it more difficult for them to fight the disease. Providing mental health support, whether through therapy, support groups, or family involvement, is crucial for helping cancer patients cope with their journey. As cancer advances, patients and their families may face difficult decisions about treatment options. While treatments like chemotherapy and surgery can prolong life, they can also be harsh on the body, often leading to a reduction in the quality of life. At some point, patients and their families may need to decide whether they want to continue aggressive treatment or shift focus to palliative care, which prioritizes comfort and symptom relief. This decision is highly personal and should be made with the guidance of medical professionals, taking into account the patient's wishes, prognosis, and overall health. Many cancers, despite advancements in medical research, remain challenging to treat. However, innovations in immunotherapy, targeted therapies, and personalized medicine are providing hope for better outcomes. Immunotherapy works by stimulating the body's immune system to fight cancer more effectively, while targeted therapies aim to block the specific molecules that promote cancer growth. These treatments offer the potential for more effective treatments with fewer side effects, but their availability and success can vary depending on the type of cancer. Finally, it's worth noting that the journey with cancer is often a community effort. Family members, friends, caregivers, and healthcare professionals all play an essential role in supporting patients. Their involvement is crucial not just in providing physical care, but also in offering emotional and psychological support. Cancer may be a personal battle, but it is one that no one should face alone. The progress we've made in understanding cancer and its treatments over the years is encouraging. And while there's still much to learn, the hope is that more effective treatments will continue to emerge, offering patients better survival rates and improved quality of life.